So, and it didn't print out on mine, but basically, and I'm going to recap, relax to digest, think about optimum absorption, think about quality for nutritional value, reduce your body's burden of toxic metals, pesticides. Interestingly, there aren't, did that go out? Oh, no. There are not a lot of different things that we can do to reduce the pesticide burden. Things like infrared sauna is very useful. So that's a good reason to not put them there in the first place. And there is increasing evidence that Parkinson's has a lot to do with exposure to pesticides. Oftentimes it is those people who are actually putting it onto the plants and the soil, but you know, it's not a disease that we really want to encourage, not that we want it to happen to us. Become aware of what you're doing. Don't let it be an automatic pilot. Be aware so that the body knows that it's being nourished. Pay attention to your rhythm, whether you have a nighttime or daytime cycle. Pay attention to when you should put the calories in. One thing you might do, for example, if you're more nighttime, measure your temperature. See when your body is actually functioning, because that will be an indication of your metabolic rate. For example, improving thyroid can help. Balancing hormones, balancing digestive enzymes, all of those can help. Allow the pleasure from what you're eating to come into your daily life and reduce the stress while you're doing it. You know, allow the thoughts, allow yourself to see yourself as being successful, and then learn the nutritional lessons that you have to teach yourself. So in terms of the slow down diet, those are the components of it. I want to talk a little bit more specifically about other things that can be helpful. And you asked about exercise. There is a wonderful book, and I didn't bring it with me, but it's PACE, P-A-C-E, by Dr. Al Sears. And also there's another book called The Paleo Diet. Both of those work very well together. Paleo talks about eating things that we evolved with over time, eating those things that are grown, that are found locally, that are more what our ancestors may have eaten. Now, they may not be for everybody, but he does talk about the role of exercise. And interestingly, then Dr. Sears talks about interval training. We didn't just, well, some people do just run all day long. I think some of the tribal folks may have had a lifestyle where they were running, delivering messages in different countries. But most of the time when we were hunter-gatherers, we didn't run constantly. We ran in intervals. And so we ran in spurts and then relaxed when we'd actually caught whatever it is we were going to catch. So he talks in this interval training about how we go about aerobic exercising correctly. And then he has an excellent 12-minute program in there that is actually designed to help people lose weight. So he approaches the concept of exercise and interval training very differently. I will say, if you're going to look at that book, don't be dissuaded by the beginning. It sounds like an infomercial in the beginning. He kind of goes over and over the same ground. But the information, the exercises are great. And I highly recommend at least glancing at it. I think you could probably get it from a library or a bookstore. But it does have an excellent 12-minute program. And he talks in there about the role of aerobic exercise and doing the different intervals. So you have more specifics on intervals, though, that you want to know about, or? Well, I like all those activities because they do relax muscles and joints and all of the flexibility. I've actually seen so many patients who were exercising them to death and getting themselves to death and were getting nowhere. So I think it has to be a healthy balance between the two. And the concept in these two books that talk about the role of aerobics in our daily lives, he actually maintains instead of aerobic, we go into anaerobic. which is not very effective in terms of burning off what we need to burn off. So what I want to advocate is you make a plan. I'm sorry, I made a bad segue there. I want you to make a plan for how you can approach weight loss using some of these concepts. Clear the pantry out. Picture food as fuel. Go for foods that are low glycemic index. What that means is foods that do not spike insulin in the body. Refined carbohydrates do this. Our habit, let's say, of having coffee and a chocolate bar at 4 o'clock spikes the index, the glycemic index. It spikes your insulin, causes you to actually be hungrier by the time you get home, causes grazing. So want to watch those things. If you're going to have some type of a sweet, some type of a refined carbohydrate, try and have a protein with it. It will blunt the effect. Eat complex carbohydrates, in other words. But I want to caution you, I see many patients who have sensitivity to gluten, and it's increasing. Food allergies can be a big component of the inability to lose weight, can contribute to symptoms of inflammation within the body. So clearing out food allergies, particularly sensitivities to gluten, and you can definitely have non-genetic gluten intolerance. And part of that is because the grain wheat is no longer the grain that we evolved with. There were many varieties, and it's been brought down to where we only have a few. And what has happened is they've concentrated it for yield. And in the yield within the heads of the wheat, they also have increased the plant's protective chemicals. Everything that we consider to be an herbal, botanical or herbal medicine is based upon the plant's use of it. It's not for our benefit, it's for the plant's defenses against things that would eat it. So it's concentrated that within the plant. And so I would say at least 50% of the people I see have a gluten sensitivity. And many people also have dairy as a problem. And I see lesser amounts of things like corn and soy. Soy's a big one too. So eliminating food allergies is important, along with the ability to digest foods. Focus on proteins, vegetables, and fruits with some complex carbs. Eat early in the day. Make time for physical fitness to burn oxygen. So I want to talk about walking. And many of us maybe don't think walking is an exercise. But at a minimum, exercise 20 minutes a day, 3 times a week. Optimally, it's 1 hour a day, 6 days a week. If you're doing the Al Sears program, you may exercise for 12 minutes, but then you could walk for the rest of that hour. Walk for time, not for speed. I always thought the opposite. I thought I had to walk really fast. But what that does is it burns sugar. It doesn't actually burn the fat. You want to involve the body, so as you walk, swing your hands, work with weights, do whatever can help during that time. And I included in here a magic formula. This was from the Walking for Fitness book. If you walk 3 miles a day, you'll burn 2,222 calories per week, a little less than it's about 2/3 of a pound. You'll walk for 222 hours. You'll walk 22 miles per week, and you'll get 2 minutes of extra life for every minute of walking. Now that's a pretty darn good recipe for health. And just realize little changes make a big difference. Oh, I'm sorry, excuse me. We'll be here probably another, maybe, do you think 20 to 40 minutes? I'm ending my formal part, but people may end up with questions. Okay. Devona, can you? Yeah, thank you. sorry, there was somebody who needs to do some activities here. So I don't have anything more formal. I'm happy to answer questions or address specifics about diets. The microphone went away. Yes, ma'am. Can you be more specific? Okay. So what type of, does anybody mind if I ask her specifically what type of diet?
Well, I went to see Dr. Zioli, and I itemized what I ate for the entire weekend. He says, this is lousy. Well, I had...
A vote of confidence from your doctor. No.
Oh, right, yeah. And so he prescribed, more fat, more eggs, not more, but just he told me to eat more, but meats and lots of proteins. What happened, I didn't have proteins in my diet at all.
Okay.
Well, I ate fish, but not enough. So, and I went to see him because I've been gaining weight. So I want to know how I can lose. And instead, I've gained more.
That's a week and a half. Let me mention something along with this for everybody to understand. And what he's doing is he's recommending that you eat more. Yes. Without fats, we can get essential fatty acid deficiencies, run into problems, increase our inflammatory processes. But what you want to do, what you want to emphasize in any diet, is eat foods that are, I'm going to say this wrong, foods that are not that are calorically dense, but that are dense. What happens is they actually, when we fill the stomach with things like vegetable matter and fiber, it actually signals a response to the brain that says we've reached satiety. And it turns off the digestive enzymes, it turns off saliva, it turns off the things that then stimulate us to eat. We want to avoid things that are calorically dense but not nutritious. For example, I don't care how many times they say high fructose corn syrup is sugar. Don't eat it because it's a calorically dense product that is not satisfying. You want to go for bulk, you want to go for volume, but things that are not calorically dense. That will lead to satiety and help you lose weight. Where he is with you, he's trying to bring you from here, to the midpoint. And he's actually working on improving your overall nutrition, your ability to metabolize. So yes, you may be gaining a little bit of weight now, but I'm sure that when your body optimizes, you'll start to drop again. Or he'll have an adjustment for you for that.